involvement process with Johnson County here to discuss the ARPA funding that the county will receive. I want to get started by having some introductions, and then we'll talk through the agenda, some housekeeping. We'll have some background and some framework from county staff, and then we're going to really get into the input session, which will be broken into some groups to make the most efficient use of our time. So don't settle in too much, because we're going to ask you to kind of shuffle around. So I will start. I am Rose Schroeder, and I am a planner with a firm called Bolton & Mank. I've been a professional planner for 20 years, do lots of public facilitation, other kinds of meetings. So I'm working with the county to have some different methods and different ideas of how we can get some input and some resident, business owner, stakeholder input into prioritizing this funding source. With me today is also Elizabeth Hanson. I'll let her introduce herself.
Yeah. Hi everybody, I'm Elizabeth Hanson. I'm with Midwest Municipal Consulting. I've been in business since 2016. I'm also a career city manager, and I've been for about 18 years as well. So have some facilitation background as well, and working with Bolton & Mank and partnering to help Johnson County have a very open and fair process for this work. So, and now Johnson County, Donna.
Good afternoon, my name is Donna Brooks, and I'm the grants coordinator for Johnson County, Iowa. I've been in my role for about 4 years, and I know many of you because you are our community partners and you are participants in our annual Quality of Life, Economic Development, and Social Services Grant Program. Those of you who are new, thank you so much for coming. We appreciate your perspectives and insights as we move through our first public input session today. And we look forward to hearing what kind of the experts in the field and on the ground have observed in the last year and a half, and any ideas that you may have on how to address some of the challenges that have become apparent because of the pandemic, whether those are public health related or kind of systemic issues that Johnson County could work harder to correct. But again, thank you so much for coming, and I'll let my colleague Allison Wells introduce herself.
Hi, I'm Allison Wells. I'm the grants assistant, and I'm new to this part of the Johnson County team, but we are very eager to hear your input, and we're very happy that you all came today.
And I'd like to take one more moment to thank our media and production technology specialist, Gio, for helping us set up. He's recording this public input session for any organizations or members of the public that were not able to be here in person or would like to reference this at a later point. Johnson County will make this recording available on our channels. And I'd also like to thank our communications coordinator, Kelly Andreessen, who will be here assisting as well. And of course, big thanks to our City of Iowa City Manager, Jeff Fruin, and one of our supervisors, Rod Sullivan.
So one of the things I would like to do before we get started is I would like to know sort of who is in the room. So if we can, I know there's many here, which is great, but if we could kind of go up and down the rows and kind of introduce yourself and who you're representing, if it's an organization, that would be very helpful, especially to Elizabeth and I. So could we start here in the front? And do speak up, obviously. I have the benefit of shouting to a mic, but in math, sometimes it gets a little muffled, so.
I'm Barbara Whitaker, and I work with the Iowa City Free Medical and Dental Clinic. And this is my colleague who also works for the clinic, Stacy Wilkes.
I'm Giselle Ruskowitz. I'm the program director at Iowa Valley RC&D. I'm Nikki Ross. I'm the director at Table to Table.
My name is Elizabeth Bernal, and I'm open to organization helping Latino, Hispanic, and Black union communities.
I am Benjamin Maliago, and today I'm representing the Center for Work and Justice. I'm the president of the Center for Work and Justice.
I'm Jill Stromquist. I'm a volunteer and ally of the Center for Work and Justice.
I'm Jonathan Azola, and I'm a volunteer for CWJ.
I'm Jessica Simon. I'm a Mrs. Ford is Executive Director at 4Cs, moving for the chapter.
Sarah Nelson, I'm the Executive Director at Community Services.
Casey Jurgensen, Teamster 238, Iowa City School Bus Company.
Michael Lake, manager for the St. Fairgrounds.
Scott Iowa community.
Danielle Rodriguez, the Tax Director of Operations Management.
Dan Ramsey, Chief Steward, Teamsters Local 238, representing the Iowa City Schools.
Rod Sullivan, Johnson County Board of Supervisors.
Ellen McGee from the Housing Trust Fund of Johnson County.
I'm Katie Beekler. I'm with SBA Local 199 and also here on behalf of CCI and the Excluded Workers Fund.
I'm Ann Baker, I'm chair of the Healthy School Based Connect.
Thanks, Laura. I'm from Relief Legal Services. Selena McCarty, the Hospice and Homes Management Director.
I'm Chastity Blue, I'm the Development and Volunteer Program Creator for the David City Young. Christy over the Practice Intervention Program.
Jeff Lewis, City of Iowa City.
Keith Merrill, for the Shelter House. Sarah Martinez, Access to Independence.
Amy Crowley, Sally Meyer, Medina Group. Kathleen Workman with the Recreation Program.
Roy Sanford, Johnson County Supervisor.
For me, looking at one of them.
Chelsea Marple is the Arctic Southern Director.
Is there one more message?
Thank you all so much, and again, thank you for being here. I'm going to run through the agenda, which should look very similar. If you pick one up over on the side. The first thing we're going to do is have kind of some educational piece the county's going to share with us, kind of the framework of what we're here to do with the ARPA Local Recovery Fund. We're really going to talk through, or Donna's going to present the eligible uses, right? So we're here to get input and feedback, but we want to have some framework for what kinds of things, programs, this funding can actually be used for. And really what we're doing, this is the first really 6 sessions, but 5 sessions and then kind of a collective town hall meeting at the end. And each session is certainly open to anyone, but it does have a bit of a different focus and subject matter because the range of eligible uses are great, of course. They're not all centered around one issue. And really, we will assemble all of the input in all the different methods that we receive throughout these input sessions into a report that reflects what we heard and when we heard it and in what way, and survey results, the survey that the county already had underway, and a variety of other tools into a report that the county can use for helping to make and prioritize decisions. We're also going to, throughout the day, show you places you can always stay informed with the county's website. They'll be always making updates, so we'll show you that. And so once Donna walks us through all of that, we are going to break into some smaller groups and have some discussion. We've got some questions prepared, but we certainly want to hear from everyone. So we'll kind of work those small groups in a somewhat guided format so that everyone has a chance to be heard, and we can get out any of those big picture comments, concerns, ideas that we're really here looking for. Then we'll come back together after those small group sessions, and we'll report back out so that each of the other groups can kind of understand and hear the conversation maybe that was going on with the others. And then we'll really wrap up with kind of next steps, what happens next, where you can find additional information, and really kind of close out that way today. So that's our overall process.
I'm going to just quickly go over some of the agenda items real quick. So if you're just coming in, we do have an agenda at the table. And there is also the county will want me to beg you to take the survey either by clicking on the website there, or there's a QR code at the table, and there's also a hard copy. My understanding is that online, it's in a couple different other languages, right? Is that Spanish? Go ahead.
Our survey is available on our website in French, Arabic, Spanish, and English. So we would certainly direct members of the public and organizations to please share that widely and take the survey themselves.
Now, if you need something to be in your hand to remind you to maybe get the link to other colleagues and other members and other clients that you have when you leave here, then I would say maybe you want to grab the hand copy so that you can remember to do that, because that's another really good idea, is to link that to your clients and your customers. Again, there's also comment cards, and so when you get to the tables, you have another opportunity there to leave some information with us today. And otherwise, the restrooms are at the end of the hall to the right, and there's also a water fountain there, and then there's some vending downstairs. I think that is what I have right now. I think we're ready for Donna to educate you on the ARPA.
Thank you so much. All right, so I will very briefly go over Johnson County's initial planning framework. In February of this year, once the American Rescue Plan Act bill was kind of still pending in legislation, but it was anticipated that it would pass, Johnson County formed what we refer to as our ARPA leadership team. And the purpose of the ARPA leadership team was to build a structure, trying to do an inventory of processes within the county and the community to make sure that we could equitably deploy this funding. I think a lot of local governments and nonprofits alike learned lessons from the CARES Act funding and how quickly that was passed and pushed through, and the consequences of pushing large amounts of money quickly through a system that we know leaves people behind. So Johnson County from the beginning has been working very diligently to lay a foundation and take the steps necessary to truly understand the needs of our community and not presume to know the needs of our community. Hence the series of public input sessions and our gratitude to you all for being here today. Rose, if you could pull up our... this document lives on our website, johnsoncountyiowa.gov/ARPA. This is one page of a 31-page planning framework that the ARPA leadership team has put together to help inform the public, our community stakeholders, as well as our departments and offices as to how Johnson County Board of Supervisors and the ARPA leadership team will move forward in receiving input, managing that input, and then making funding priorities based on the needs of the community. Our three-pronged approach is stabilize our community through equity-focused services, strategize together to invest in future prosperity, which is what we're doing today, thank you for coming, and organizing our resources to ensure inclusive recovery. I won't get too far into each of these, but I really wanted to visually show you, these are not just buzzwords that we slapped up here. These have been very critically thought through, and we're serious in our efforts to truly understand the needs of the community. I want to make mention that it is the mission of the Johnson County Board of Supervisors to enhance the quality of life of residents by providing exceptional public service in a collaborative, responsive, and fiscally accountable manner. That mission is guiding the way in which ARPA planning and deployment of funds will take place. So I just wanted to kind of tie that all back to our efforts today and over the next 4 or 5 years, honestly. So the objectives of today are kind of what I mentioned, to gain an understanding of those needs, not just of our nonprofit organizations and our service providers, but also the residents and communities that you all serve. We know that the last 18 months has been an incredibly challenging time for you. We've heard from many of you. Thank you for keeping us informed of what your struggles were. And I also want to say thank you and congratulations for the very creative and dynamic ways you all changed the way that you provided services to respond to the pandemic and continue doing the good work that you do. We want to focus on supporting community response to the COVID-19 pandemic, and also really that kind of equity-focused lens. We need to make sure that our efforts are inclusive and equitable across the board, and we really are following the U.S. Treasury's requirements for compliance and also reporting. And the U.S. Treasury does require that local governments seek public input on their deployments of local fiscal recovery funds. Johnson County was allocated by population $29.3 million, and we look forward to discussing some of the ideas and funding priorities for that today.
As Donna mentioned, the allocations under the American Rescue Plan Act are by population, and so the other cities within Johnson County are also receiving allocations based on their population. We have been in correspondence with all of them to try and collaborate to make sure there's no duplication of efforts and to make sure that we're all gathering public input for the different communities that we represent. School districts are also receiving funds as well, and these are all ones that are represented within Johnson County.
We released a press release last week that outlines our initial schedule of 6 public input sessions. I want to be perfectly clear that, and I want to recognize that you probably already see this and understand it, but the ongoing consequences of the COVID-19 pandemic evolve every week, if not sometimes every day. So this is not a box that we are checking. Community input and assessment is going to be an ongoing priority of Johnson County as we make funding priorities and also reevaluate every fiscal year to see how those priorities may change in response to the needs of the community. Our first series of public input sessions begins today, thank you, and it goes through what we are having as kind of a public meeting town hall session at the end of October. These public input sessions have been designed and developed to be targeted to kind of specific communities in Johnson County. Today, obviously, we've asked our community partners, nonprofit organizations, and service providers to join us. Monday, we are having an open house kind of public input session for our more urban communities, including North Liberty, Coralville, Iowa City, University Heights, and those things. In September, we're going to have a targeted session specifically focused on addressing the negative economic impacts that the COVID-19 pandemic had on Johnson County residents, workers, business owners, and impacted industries. And then in late September and early October, we're going to be having facilitated sessions for our more rural communities and unincorporated areas of the counties and issues that may be specific to those folks. So those are going to be held in locations that make sense kind of based on proximity, so we aren't asking our rural residents to come into the county seat, but they're geared towards, the first one will be geared towards to our rural communities and unincorporated areas in northern Johnson County, and the second one will be in southern Johnson County. And like I said, our final session will have Bolton and May kind of present the feedback that's been received to date and summarize that information. And then we want to invite the public to come kind of hear the consensus of what we know and provide any feedback at that time about what priorities are essential or critical to them. So that's kind of our process and timeline of public input. And I think I'll let Bolton and May take it from here, correct? Oh no, I have one more, yes. Yeah, I know, I'm pretty quick to hand that off. So I'll kind of go over these quickly. The allowable uses under the American Rescue Plan Act, local fiscal recovery funds, and that is one quick point I want to make is the American Rescue Plan Act is $1.9 trillion in recovery funding. The state and local fiscal recovery fund is just one portion of that enormous funding package. So these allowable uses are specifically to our local fiscal recovery funds, and this funding can be used to support our public health response, to provide equity-focused services. And when I say this, kind of, a more tangible example is really addressing the health and educational disparities, investing in housing and neighborhoods, and promoting healthy childhood environments. This could include things like lead abatement programs or home repair or in-house tutoring, things like that. Premium pay for essential workers is another one of the allowable uses. Essential workers are defined as those who perform regular in-person interactions or regular physical handling of items. An individual who teleworks from a residence is not eligible to be an essential worker. Another allowable use is addressing the negative economic impacts and responding to those harms to workers, families, small businesses, and public sectors. And those would be through direct payments, through grant programs, through expanding public services and stabilization opportunities for our residents and businesses. Broadband infrastructure is allowable, as is water and sewer infrastructure. And some examples of water and sewer infrastructure for those who may not immediately snap to a project might be those projects that may enhance water quality, such as watershed management or flood resiliency, or expanding water or sewer infrastructure to help foster economic development in rural areas. That might be a good tangible example. So,
Donna, where could everybody find that information?
So again, that is pulled directly from our planning framework that's on our website, and that's johnsoncountyiowa.gov/ARPA, ARPA. And this is Johnson County's planning framework document.
One more question, Donna.
Yeah.
On all of those, you kind of said there's some examples. Where could they find examples of each of those so they can see if something's eligible or not?
Well, we Google every day because as local governments are navigating this unprecedented funding, and we also receive regular updates through FAQs from the U.S. Treasury. We're still working off the interim final rules, so I wanted to remind all of you in the room. I know it seems like maybe we're not moving as quickly as you would like, but we are moving at the pace of the federal government. So we really truly are doing our best, but more allowable uses and guidance become available every day. Our ARPA website will be constantly updated. We update it after every public meeting we present at, just to make sure that those presentations are available for the public to view. So basically any changes should be there in real time. All right, now, I know I talked a little bit about our planning framework, and one of those initial, verbs or whatever is stabilize. And we recognize that we have got to respond to the economic impacts to workers, families, small businesses, and impacted industries immediately, and we recognize that people are still suffering in Johnson County. Johnson County leadership team worked closely with our social services department to expand our general assistance program, not just the funding, which was increased from $500,000 to $2.5 million, but also the eligibility requirements. Some of the key changes that were made include the fact that residents are no longer required to provide citizenship status or identify citizenship status. Residents who receive other federal benefits, such as Social Security, are now eligible for Johnson County's General Assistance Program, where they would not have been eligible in the past. This is especially meaningful for some of our aging populations who live on fixed incomes. The federal poverty guideline was increased from 50% to 200%, so it was nearly quadrupled. And there are some other provisions that were expanded or introduced, including burial assistance, things that promote healthy homes, such as vacuums or air purifiers. So there's a lot that's into it. I encourage everybody to please visit our website, johnsoncountyiowa.gov/social-services/general assistance, to learn more about the ways in which Johnson County has expanded general assistance to really provide that critical stabilization and address the needs of those residents that are still suffering.
All right. So before we get started and break into some smaller groups for some discussion, just want to talk a little bit about kind of some standard expectations for today. So everyone's ideas are important. We want, as we break into these small groups, for everyone in those groups to have a chance to share. We want to make sure it's not dominated by one or just a few. We want people to listen to others, of course, when you're talking, even if you happen to disagree. We want to make sure we keep the focus on issues, not people or groups. And really, again, today is a focus to sort of all of you as stakeholders and the services you provide and the organizations that you're representing. So we really want to hear about what you see every day, what you hear, what you feel needs are. Those are the ideas we really want to come away from this particular session today. Now, as those small group discussions are happening, if you hear someone say like, oh, let's set that to the side, let's park that in the garage, it doesn't mean that what you've said we don't feel like is relevant or valid. It may just not be today's point of discussion. So we will record that, we will keep that. Please don't be offended. We know everyone has limited time today and we want to focus to the extent we can. And to the presentation that Don already gave today really is about starting this public engagement process and learning and listening and understanding. So with that, if we have a great turnout, even more than we perhaps anticipated. So the tables that are pushed together, if people could gather about 10 or 12 around each of those, we're going to push another set together, I think, as well. So it's kind of a more evenly split kind of group. If your organization brought more than one person, that is wonderful. But maybe divide and conquer a little bit. Like maybe join a different group or table for a different part of the experience.
Find a secretary at your table, that would be really great, to take notes on the easels behind you, and should be a couple markers on each table. So everybody point at one person, and then they'll be the secretary at your table. If you could find one back here. Wonderful, thank you so much. Thank you. We're going to go through 5 slides and we have a number of questions for you to brainstorm, and if the secretary could jot down what you're hearing, that would be how we're going to be able to collect the information. And then again, like Rose said earlier, we will gather together at the end and have you report, and we're going to report and document your feedback live. So your handwriting doesn't have to be beautiful because you'll be recording, but if you could, if you know how to read your own handwriting, that'd be great. So the first question is on the screen, and if you can't read it, it says, what specific negative impacts of the pandemic are you, your organization, or your clients experiencing? So what specific negative impacts are you or your clients experiencing?
As school bus driver, I experience lots of negative because they're very mobile, which puts more burden on but I can make it.
Okay. All right, we know there's much more to be said, but we are going to move on to kind of the second question, prompting question. And we're going to shift gears a little bit. We want to hear about the programs and projects maybe that have been effective on some level through this process. We know there's lots of challenges, but what is working and how do we respond to some of the groups that really are disproportionately, disadvantaged in this. So let's think a little bit again about what things have been effective and helpful to date. And let's brainstorm a little bit about that and what those could look like or might look like moving forward.
All right. So question number 3 is up on the screen. It's about additional support. So you just talked about what isn't working, what is working, and now we're gonna ask you, how can the response be better supported? So please consider what additional support and how can the community-wide COVID response be better supported?
I guess it might be.
All right, everybody, we need to move on to number 4. Question 4 is regarding equity. So having a fair and unbiased process. So what would an equitable recovery look like? And what's an effective way to mitigate the economic impacts, the negative economic impacts in an equitable way? What systematic challenges can this funding be used to address? And what barriers to support the services exist? So I know we've talked about this at some of the tables, but let's really hone in on some real specific information for the county to use, and how can they be reduced? I have 6 minutes on this. Okay, let's wrap up, and why don't you pick who gets to be the person at your table that will summarize all of the findings?
Yeah.
How much time do we have?
So, fair question. So,
Okay.
we want to be respectful of everyone's time. We said 3, but let's try. We will absolutely be taking all of this with us.
Yeah.
We'll probably do some very brief kind of reporting, but we do want to hear it from you. So, perhaps on each of the sticky notes or questions, you can each provide your highlights. And, you know, if there's any feedback, we can get it that way. That way we can get all the groups to hear. I think just from Liz and I walking around the room, I think we're certainly going to hear some common themes on all of them, but I think I did hear a couple other things that,
Yeah.
So
maybe if you do have a common theme with what they're saying, look at your sheet and see if there's some other summarized items that you want to share today. We're taking, like she said, we're taking all of these with us, and we'll make sure that those get documented. But we do want to hear from you, so.
yeah.
So if you don't mind, you want to go start?
Sure.
And holler through your math. Rose is gonna take up.
Okay, so negative impacts of COVID. Taking up programs that is not the worst thing that we've experienced. Oh, thank you. Okay, so I'm just going to highlight a few, but senior citizens were experiencing social isolation. Essential workers were not able to pay for or access to health care. They were disproportionately affected by economics, lack of access to stimulus checks, unemployment, childcare. Restrictions in funding barriers, so for example, language barriers for being able to access the funding that was available, lack of consistent information, especially if you have those language barriers. Also, some of the people that were in the middle class were not able to access some of the funding. They're sort of in that between zone where they couldn't pay their bills, but also weren't able to access. And then a general theme that everyone at the table had experienced was just nonprofit human services infrastructure and people not having the capacity within organizations to keep up with the need in the community. A lot of that is talking about staffing, just being able to pay people to do the important work that everybody in this room does. Okay.
Question 2.
Question 2. Let's do 1. Oh, we're all going to go. So okay. And please no judgment on my terrible typing. We'll fix it. If you want to go ahead and talk about
Yes, because you there was a lot of focus on low-wage workers, and workers not direct capturing, but also making more money if you're on unemployment than if you're actually going to work 40 hours. Uninsured and underinsured folks.
Can you speak up just a little bit?
Yes, uninsured and underinsured folks, medical harm and inequities based on race and ability status really came through in the pandemic. Increase of substance use disorders and not necessarily an increase of the space to where people can go for treatment for those disorders. Shortage of caregivers, small businesses struggling, mental health crisis for parents and people and families all over. I think not a lot of resources or not a lot of referrals to those places during the pandemic and quarantine. Internet is an easy infrastructure issue, right? Having one family with 5 kids in one hotspot, that doesn't work, right? Transportation, and then the big question is the flexibility for the things that we can't predict, because like we couldn't predict right now, we don't know what 3 months from now is going to look like, so we locked into this is our plan, just probably for where we're at right now.
Thank you. Thank you. You're up.
So our group, pretty much all of us that were discussing talked about decreased mental health, good isolation, and you also housing.
Can you speak up a little bit too? A little bit more? Speak up a little bit more, please. Thank you. Okay.
We have a lot of issues about loss of staff. And then to difficulty in finding volunteers and staffing. Challenges for people navigating available services due to various status of emergencies. Otherwise, it's still possible.
Thank you. Are you ready, sir?
Yep. So we talked about school bus driver shortage, which meant that the current drivers just had to work longer days, so a lot of worker burnout, probably in all sectors. Thanks. A lot of us nonprofits were not, like technology-wise, we didn't have the best equipment to switch to working remotely. We had donated computers, things like that. Johnson County Fair Board, just workers and volunteers, difficulty finding them. Many of them just not available to work because of housing difficulty, daycare shortage, or just transportation, lack of transportation. Free clinic talked about small building, limited space, which then limited how many clients they could have, or the number of volunteer providers that could be based there. Patients losing insurance because they couldn't work full-time or hours were limited. Just more uninsured patients. Patients not having accessible, like appropriate technology to be able to do telehealth appointments. Yeah, within the refugee and immigrant community, it's just scared to go to work and how they would be treated. I think that's.
Thank you. Okay, well, we'll go around with question 2.
See, we're collaborating already. Programs and projects that work well. Just in general, programs and projects that had barriers that were reduced. So, for example, people who are doing food access work, not having to ask the recipients about their income status or their age of their children or what have you, like having fewer requirements in order to get people connected to services that are provided. Meeting people where they're at, being able to deliver to homes and neighborhoods, like a mobile food pantry is a great example of that. Center for Worker Justice is doing amazing work and building bridges, so being able to have relationships with people in the community, know what their needs are, whether that's paying rent, paying different bills, having medical bills paid, and being able to coordinate and advocate both with individual funders, people who wanted to donate their stimulus checks perhaps, and also the organizations themselves, like the energy companies or those people who are hunting down rent checks, and being able to sort of bridge the gap there. In general, again, the most vulnerable people in our communities were those low-income folks who Luckily, the stimulus checks really helped, and the unemployment insurance really helped for those who were able to access it, but people, excluded workers, were not able to, so again, that came up as something that needs to be fixed. The PPP loan saved a lot of businesses, saved a lot of nonprofits. If we could get some of those things, those programs that work well, access to everyone is something we talked about, students, refugees, immigrant communities, and make sure that there's no strings attached. So another thing that worked was there was funding for farm to school that worked really well, and more students got to access local foods, fresh foods. But yeah, just in general, we talked a lot about just reducing the barriers to access the resources that are there and make it easy for people to do the work that we do in this room. So if somebody needs $1,000 check, to just be able to give that to a person if they need it.
Thank you. Did you probably have the exact same? No.
Exactly.
One of the things that we took away is it's really highlighted this positive and the true equity opportunities. A lot of the food stuff, I would say a lot of the local funding that went to treatment, mental health care, that kind of thing, that our county shifted treatment or bring opportunities to people in Alaska where our need was. And really a lot of love for Johnson County Public Health. We felt they did a great job of disseminating accurate information. So go along and short.
That's good to hear.
In what you heard, we talked about the COVID unemployment incentive for conference for very effective. We need the relationship that farm drives are great. Something for a lot of our opportunities, so that's really well. Community partnerships, creativity, allowing people to create. No contact pickup was an interesting.
No contact pickup?
Yeah, I mean, so that services very limited to these private public partnerships, the nests and online school, those are very good, and safe. And decreasing incarceration was a conversation that we had and how to really effective people go safe and also address activities. That was one of them. And our local government partnership and how it was accomplished and our own work on credit.
Thank you. Ray Jason? You guys?
Talked about school bus drivers, even though they weren't driving, there was still the contracts and funding was in place to be able to still keep them paid so that they didn't have to lose their position or go find another job. We talked about grant programs were really helpful for rent assistance and stuff, but we did talk about that there has been some lag in eventually getting that to the people that the rent was to be paid to. We talked about just that people wanted to help more and help more their peers. We said that we put an asterisk that just a lot of funders simplified the funding or grant requests during the last year that helped the nonprofits apply for more funding or focus attention to putting out other fires. Talked about the public health, just again, I think everyone talked about this, did a great job sharing information and listening to input. And that the pandemic did help nonprofits and others form new collaborations that probably wouldn't have been created without the pandemic. That's it.
Excellent. So you got into what went well, and now this next question was about what we could do better, right? You want to first it? We're going to go this way? Okay.
We talked about now is the time when there needs to be more like need-based public assistance, like help with the transition as more jobs come back to full-time roles. A lot of still reduce hours still. Transportation is still a giant barrier. There's a lot of like mobile options, health related, like mobile clinics, but we just need more of them so that they're more accessible. Some of that's connected to lack of transportation opportunities, especially on weekends. We need to think more about nonprofits being seen as an investment versus a charity, so a form of infrastructure. Nonprofits are vital professional organizations in the community. Maybe helping create more options to help to incentivize or create that nonprofits create more partnerships with each other. We talked really there about helping individuals navigate services. So if nonprofits were more partnered together better, they'd be able to help others navigate other services that a nonprofit may not provide. And the pandemic just showed a lot of us our weaknesses that were kind of hidden in our organizations.
Thank you.
Yeah, we just have three institutions throughout the city. Increased housing services and affordable housing, which includes water services and money for peace and actually deliver those services. And improving coordinated entry support for the continuity and speed of assistance. We also discussed the hoops for the funding are challenging for people that don't need more rigorous activity to respond to additional populations, including our immigrants. We work people with guide services throughout town and assist with that, mental health services, language barriers, and direct cash payments. We talk about self-determination and people should have a choice for themselves. Funds and not everyone's rent or utilities that other banks need direct cash payments for bills that they have that don't fall into one of the categories. Then we talked about mental health services, youth support, and barriers to the direct and family barriers that doesn't have the
Thank you. We switched people, sorry how we were meeting. So we talked about knowing barriers to access and also like making sure that those aren't barriers anymore. So things like direct cash payments to exclude workers, there should be language barriers, internet barriers. There should be a requirement to prove status, and it should only take a personal statement of need to be able to get those cash payments. Internet, making sure that there's quality and reliable internet for everyone, so everyone has access to it. Child care, with struggle during the pandemic, want to make sure folks aren't falling into those cracks. School funding, housing, and housing, making sure it's affordable and quality housing. Student loan issues, collaboration between funders. Talking about making sure we're talking about what comes after this crisis, so that we're making sure that we're still there for folks. Real solutions for homelessness, so if we're not going to do direct cash payments, and we're not going to make sure that there's affordable quality housing for folks, then what are we going to do about an increasing homeless population? And then also addressing the underlying inequalities that create these issues.
Thank you all for being here with us. We just got
Okay, so how to better support, we talked about, again, the direct cash payments to folks with no strings, and when those individuals who are living in poverty can have access to that, that makes a big difference. We talked about increased networking and coordination. So for an individual trying to get access to the services that we provide or the resources, is there a central repository or a roadmap or a way to make that really easy to understand? And we talked about that for us as nonprofits, like if somebody find all the services we provide in one place, for example. And then the need for skilled staffing, it came up time and time again. Somebody, for example, who works with in mental health care, that person needs to be trained, they need to understand, and they need to be able to respond quickly. And as we see the increase in mental municipal health crisis. We need those kinds of workers, but really across the board, for our organizations, we need to have the capacity to pay people, and then increase the communication amongst our network, which we think should be in organizations. So can we grow that capacity to better coordinate? Because I think one of the elephants in the room is that there's like a finite, I don't want to like say that we're all fighting over the same pieces of the pie. The pie is really big, and we have to decide how we can all collaborate really effectively to not be fighting, but to be better coordinated, because we're all working towards really helping make our communities a better place. So, and then the last thing was private and public funding, and doing public-private partnerships. There's an example of a third party coming in and doing immigrant relief funds in Washington that was interesting. So that's what we came up with.
Thank you. Are you ready for the last question?
I'm as ready and still typing as poorly as I'm gonna be.
Okay. You're ready. Go ahead.
Okay.
This way again.
I think we struggled with this one because we got off on tangents.
That's okay. Well, it's fair and equitable, right?
But I think we wrote down like things need to be in more languages, because it's just barriers related to language or literacy. I didn't write it, but even just in simple language, plain language, like things are too bureaucratic sometimes to even understand how to read stuff if you're an individual applying for services. Nonprofits need more shared working spaces for all of us to collaborate. Yeah, I don't know what. Yeah, just more investment into the nonprofits. But yeah, we've lost where we were going on this question.
Okay, we appreciate it.
Any questions that primary people talk about that there will be some comprehensive needs assessment done, elevating and reducing actual spaces for neighborhoods and areas where there is great need and not necessarily meeting prices of the week for all of us sharing needs, but actually talking to the population who serve those needs correctly. So we talked about funding accessibility, reducing barriers, reducing accessing, cross-cultural competencies, families' ways of self-determination of thinking that people across immediate needs, liquid and emergency funds, technical ways of communication and services. But that, the last thing we discussed was that the speed of this assistance of the current timeline is actually inevitable for those very high speed.
I'm sorry, can you repeat the last?
So yeah, the current timeline for delivering these assistance is inevitable for those that are at the highest level of need right now.
Thank you.
So some of the things we talked about are hiring minimum wage, and also providing skilled labor training, so that folks on their down have opportunities. There was some talk about how unemployment pays more than what a lot of essential workers are making. So ensuring that there's hazard pay for essential workers to make sure that they are also being compensated for the risk that they're taking on. Awareness of white standards and access issues that all of these issues cause, which means that we have a lot of shift in how we measure success, quality over quantity. We put down the funding excluded workers coalition, but essentially direct cash payments to excluded workers and hazard pay for essential workers, ensuring that there is affordable quality housing and eliminating other sort of equity issues, including living tax and nonprofit payments. Eviction prevention past the pandemic, because we know that this won't just stop if the pandemic stops. Communication strategies, making sure that cultural awareness and access are all part of the conversation. People living in the shadows or fearful to come forward to claim the resources or help they need, being aware of that and preparing for them, and making sure that we're collaborating versus competing. And then equity is woven into all of our resources process. Thank you.
So what they said. We said again, start with stimulus checks, no strings. Also mentioned the hazard pay. 12,000 workers, according to one estimation, and 12,000 workers in Johnson County made less than $50 an hour. So there's a lot of folks out there who, if the stimulus check came their way, makes a big difference. And then I kind of had deja vu for a roundtable that happened in Johnson County not that long ago, but just talking about how we could make investments in infrastructure, but there's lack of access to. We talked about lack of access in broadband, internet, and housing, transportation, especially buses, you know, not coming at times that always work for people, access to food, access to early child care and after-school programs. Again, for those folks who are running those programs or doing that kind of labor, noticing that it's about being able to pay people for their time oftentimes. And then capital investments for nonprofits, which is really similar to what some of the other groups said.
Very good. Well, thank you all. Maybe Bruce is going to talk about next steps. Because I think that's what you're probably wondering where we're at now after you've provided all this great information to the county. Okay, and then another call.
Yes, sorry, I'll just put that up there.
Yeah.
Next steps, as I said, we, and Donna mentioned, there is a remaining series of different types of public engagement sessions. And she kind of highlighted those in the beginning. So we'll continue to move forward with those over the next couple of months. But at each step of the way, all of this information, in spite of my terrible typing, we will go back to these sheets, we will go back to the recording, we will summarize much more articulately what happened here today, and at each session, as we move forward, as well as ongoing survey that's coming in from the county, any other comments that are received through the county, really providing, in the end, a summary and a documenting report about each of these touch points along the way. So that's where we're headed. I want to encourage you to check out the county's website, which is always where you will find all this updated information. Again, every time there's a public meeting, every time the federal guidance perhaps changes on eligible and allowable uses of these funds, steps along the way you will always find on the website. Donna will serve as a direct link for any other comments or feedback along the way. We also really want to encourage you to stay engaged, follow along, provide additional insight, and really save that date for that kind of concluding town hall meeting where we'll sort of do a bigger version of this. We will have prepared in advance and provide reporting out a summary report of each of these engagement sessions that we've had, what we heard on different topics, who we talked to, how we talked to them, all of that kind of information. So that is October 27th. So that is written on any number of things and certainly on the website. So please keep tabs of that. There will be an electronic availability for that for those that may not want to participate in person. And I guess with that, any concluding thoughts other than on behalf of certainly Elizabeth and myself and the county, we really appreciate your time and attention today. I think there was some really good starting conversations, and that's very helpful. Very helpful.
And thank you so much. I won't hold you up any longer. I just would like to make one final request, which is we recognize that we are not reaching all of the communities and populations of Johnson County. If you or your organization represents or serves some of our disproportionately impacted communities, please help us reach them through surveys, through direct outreach. We are happy to come to your organization if that feels like a more trustworthy or neutral ground. And if you have any requests for translations that are not in French, Spanish, or Arabic, please let Johnson County know and we will get those provided. Thank you guys so much for your expertise and engagement.